I would suggest you don't read Levine, because that would get you into a sob. Yeah. So I applied to Levine. There was no chance of my getting in because he took one fellow a year, and he took him from the Brigham. Usually the resident of medicine would apply to Levine for this very exceptional fellowship. So what was my strategy? I had a strategy. And the strategy was simply this. I'll challenge Levine on his work he did and say he did it wrong. And I know how to correct it. He'll either throw me out or give me a job. Doctors knew that if you gave a mercurial diuretic, the patient frequently developed all the symptoms of digitalis intoxication: nausea, vomiting, dizziness, asthenia, weakness, arrhythmias. Why? Levine had the brilliant idea that when you give a diuretic, what do? You draw out fluid. The fluid has digitalis. So you redigitalise the heart and you poison it. And he and Schnittger, one of his former fellows, wrote a paper that was very, very widely circulated and believed like the gospel. And that was published in about 1930s, in which they did rat and mouse experiments. And they took mouse, recirculated edema fluid, and developed ditch toxicity. And they proved it. I wouldn't go into it because I'd like to devote a session to it. As a resident in Montefiore Hospital, I thought this made no sense to me, and the reasons for it I'll tell you some other time. I thought it was due to the mobilization of potassium by the diuretic, and I proved it with finality. So my first paper I ever wrote in Proxoc resulted in editorials in all the leading journals, Lancet, JAMA, etc. And the paper was 1 page long. And I says, I'll challenge Levine on this. I knew it was an Orthodox Jew. And so when I got in, he said, why do you want to come to the Brigham? I said, well, I want to come here to prove you wrong. Very thin. And I thought he was saying, get the hell out of here. He says, we proved it with finality. You haven't read our paper. Sir, I read your paper, and I started to relate the paper, you know. I said, the Brigham is the place where I could prove with certainty. Because at that time, John Merrill, began dialysis, hemodialysis. And with hemodialysis, they were pulling out potassium and lowering it at will. And if my hypothesis was right, we could lower it by 1 or 2 milliequivalents, evoke ditch toxicity, and put it back and abolish it. Levine was very hostile to me during that interview, and I left. And I waited the longest time to hear from him.
How long is long?
About 3 weeks, 4 weeks.
That's long.
And then I got a letter, you're hired. But once I was hired, I thought I'll get into working. He says, no way. No way, he says. Do you realize how many papers there are about digitalis? You could spend the rest of your life reading it and not encompass it. He says, I want you to work on the PR interval. That's a stupid thing. PR interval. Well, that's another story for another time. But that's the way I got in with Levine. And the first year was terrible. I thought I wouldn't stay. But as I made rounds with him, I'd see patients with acute myocardial infarction, essentially tortured. I mean, you couldn't imagine how depressed patients were. Now, Levine confused the issue of acute myocardial infarction with congestive heart failure. The majority of people who came in with acute MI had heart failure because salt wasn't restricted. They were lying flat in bed. They were full of fear and morbid anxiety and heart failure. In early 40s, Levine was called on consultation in Washington to see a patient with heart failure. And the patient was gurgling. and they were giving him oxygen, using diuretics to no avail. And Levine said, why don't you sit him up? The guy was critically ill, and that was never done. They sit him up. Next day, the guy was eating breakfast, feeling good. Levine had found the cure for acute myocardial infarction, he thought. And the explanation that he gave was the same reasoning that rationalized bed rest, but reversed the argument. In essence, he said the upright posture reduced the work of the heart. The whole aim of bed rest was to reduce the work of the heart. And he invoked gravity helping. Now, Levine was also well aware of the fact that bed rest provoked constipation, provoked inanition, provoked osteoporosis, provoked thrombophlebitis, negative nitrogen balance, atelectasis, hypostatic pneumonia, you name it.
Was the role of pulmonary embolism and bed rest well identified?
Oh yeah, because the major cause of death, as far as I could tell, is pulmonary emboli.
Now, but I don't think that they link.
Well, that's what I'm
They didn't link. They know that pulmonary embolism is a problem, but they didn't realize that actually they are doing it.
That was my question.
Right.
Dr. Levine recognized that.
He recognized that, and he thought it was due to bed rest, but he was a lonely voice. At the time, patients who were admitted with acute myocardial infarction, there was no coronary care unit, there was no special ward for them. You were admitted any place on a bed availability basis. And the importance of a